This video is made possible by our loyal Patreon supporters. Visit patreon.com/PsycheTruth.
Hello, welcome. Today I'm going to be doing a massage for sciatic pain relief. I'll be working on the lovely Holly. Let's go ahead and get started. If you don't have time to watch this video right now, go ahead and save to watch later and just watch whenever you get a chance. So first thing that I'm going to do with someone that has sciatic pain is I'm going to take less pressure off of their hamstrings, because that sciatic nerve pain can really shoot all the way down the leg and kind of wreak havoc on the hamstring muscles. Sometimes I'll even stack a couple of pillows if the pain is really exaggerated. And I'm going to move Holly's arm so that to be fumbling around it. So sometimes I will just kind of see how the hips are positioned to see if one hip is lifted, because that can really affect what's going on in the glutes and the hips. And I'm gonna go right into a warm up for the hips, for the glutes, and working on this glute medius. So you want to start pretty gently with this rocking when somebody has sciatic pain, and there's a pretty wide range of the kind of pain people can feel. Sometimes that nerve pain can even shoot around the iliac crest, or it can shoot all the way down the glutes into the legs, into the feet even. But the goal as a massage therapist is to take pressure off of that sciatic nerve. And you really need to have access to the piriformis. So to start, you need to work through tightness in the glute medius and the glute max, and then go from there. And I usually take a little more time. And I really take my time with these glutes when someone is in more pain. It's not just an acute kind of annoying sort of pain. It's been a couple minutes, so I'm going to start just gradually increasing my pressure. So this is a really good test too. This can certainly be pretty uncomfortable to have deeper work done on this muscle, but it's easier than the piriformis. So it's a more superficial muscle. A lot of people have a greater body awareness of it. So if you're really struggling to do deeper work in this muscle, then you might need to communicate with your client and just take your time. You might need to schedule a few sessions to really do the kind of work you need to do. Because just because you have an hour and a half doesn't mean that you can necessarily count on that time. You just have to honor the body's process and how it's responding to everything. And that glute medius was really responsive, and I'm going to go ahead and land on this glute medius. And without that internal rotation of the leg, using that pin and stretch technique, I'm not really able to access the deeper layers of muscle tissue, but I'm going to warm up the soft tissue. And also just doing something that is predictable and that doesn't feel totally foreign to Holly if this were my first time working on her, which it's not. But And I'm going to go ahead and start with this pin and stretch technique or active release technique. So it's really on that internal rotation of the leg that you're going to do your best work. And you can focus more on that movement to really stretch out that tissue, or you can do a true pin and stretch where you land on that muscle fiber and really stretch it out. But you want to make sure that sometimes it's helpful to angle out the knee a little bit just to help the knee out a little. And as you start to find different trigger points, you might just explore this technique in different ways as different uses. You can go really slow or you can go faster. And just really taking my time here. And this glute max really needs to respond well for you to be able to get into that deeper glute muscle, the piriformis. I'm just really taking my time here. And it's that piriformis that can literally put pressure on the sciatic nerve, and that's kind of the main muscle that you need to think about when somebody's having sciatic pain. And I'm gonna go ahead and start to work on that piriformis a little bit. So one thing, Ollie does have a bruise here. So that is a contraindication to doing deeper work usually. I'm gonna see if I can work around it. Might look like I'm pressing on that bruise, but not putting a whole lot of pressure on there. And even if it's just pressing on the surface of that piriformis, you're still doing really great work. It's really important to start gently and just gradually increasing that pressure. If somebody is having severe sciatic pain, that piriformis is usually extremely contracted. So you are going to need to offer quite a bit of pressure as, you know, that area is ready. Never want to force anything. I'll usually spend at least 5 minutes just gradually kind of easing into those deeper layers of tissue. And just remember that some level of tightness is to be expected and is healthy, but you can kind of sense if it's an exaggerated kind of tightness that's not healthy. And just kind of backing it up, making sure this glute max is happy for the most part. And it doesn't always take a ton of time to do really great work in that piriformis. If you have taken enough time and you're on the right spot, it can respond fairly quickly and let go fairly quickly. I always like to at least do some compressive holds on these hamstrings after that kind of glute work. And if somebody is struggling with that shooting pain down their leg, I'll usually offer more than just these compressive holds. I think I'll actually end with, I'm going to grab some oil, do some work on these hamstrings. Just grabbing a medium amount of oil. Don't want to be sliding off of these muscles. Bringing this effleurage stroke all the way into the glutes. It's a really soothing way to finish off this kind of work. And always before working on the glutes, you want to check in with your client, make sure they're comfortable with that. Not uncommon for the hamstrings to be somewhat inflamed when that sciatic nerve is triggered. And I'll usually start by just shortening those hamstring muscles. And just flushing some of this stickiness out. And just slightly lengthening those muscles as I work my way up towards the glutes. So with sciatic pain, once I do kind of the most uncomfortable part, the piriformis, because this is secondary pain in the hamstrings, I'm not too worried about going super deep. I just want it to be helpful, and I also want it to feel good, especially if I'm nearing the end of the massage. So it's always going to feel more tolerable when there's more slack on those muscles. The glute max and the IT bands are very connected, and always a good idea to at least spend a little time on the IT band. But at this point, I don't want to do anything too aggressive. I don't want to work on that tendon a little bit and make sure that it's somewhat relaxed. You're never going to change the level of tautness that this tendon is at, but you can certainly work on that fiber and stretch it out, and just definitely contributes to the health of this area. And always ending with something that's very soothing, and with a few effleurage strokes. And including the glutes, just so everything feels nice and connected. And that is all for today. Thank you for joining me today. I really enjoyed spending this time with you. I look forward to seeing you next time.